build and relax is, if you wouldn't mind, let's take a breath or two and we'll get started. So if you're somewhere safe, close your eyes, take a breathe in, feel that belly expand, blow it away. One more time, take a breath in, blow it away. And the last time, breath in and blow it away. Great. In today's times, I figure as many times as we can get ourselves grounded and just take a breath. That's why I do that. So today, I was saying it's on the ACEs study, chronic toxic stress, and that does tie into self-care and self-care shortcuts. We have a lot of material to cover. Slides have a lot of writing. I'm not going to be reading all of them. I'm just going to give you the highlights, but this is for like your information after the seminar. The objective today, there are three of them actually, is I wanted to give you an understanding, if you didn't know already, what was behind the implementation of trauma-informed care. And then the second thing is to look at your study. If you don't know your ACEs score already, there's a 10-question survey that we're going to do, and you'll be able to find your ACEs score. The reason it's important for us to know this is because that ACEs score can impact our self-care routines. And then the third is learn the importance of self-awareness, self-regulation, and chronic toxic stress. All right, so let's rock. So the first thing I wanted to talk about, just the ACEs study in a nutshell. It was done back in 1998, and it was a study started on obesity. It was done by the Center for Disease Control, Kaiser Permanente Health System. They were looking at obesity. It was one of the largest, I think the largest study on record, and mostly middle class and white. And what they found was that people were taking weight off, but they couldn't maintain the weight loss, and they couldn't figure out why. So they delved back into the psychosocial background of people. And in the next slide, I'm going to tell you what they found. But the significance for us and the general population, once they're aware of it, is that these adverse childhood experiences are really common. And the important thing as healthcare workers is that they tie directly into our future health and well-being. And in actuality, the CDC has stated that they consider the adverse childhood experience, your score, to be a prime determinant of future health and well-being. So, you know, I always call it the science behind our story, because it validated that what we experience in childhood, it's not something that you can just go like move on, get over it. It impacts the brain and the body. So influences, ACEs impacts your neurocognitive health. It impairs social, emotional, and again, cognitive impairment. Adaptation of healthy behaviors, coping mechanisms, all this stuff comes from our childhood experiences. And there's also, we'll get to in a second, early death. Now, the ACEs study, what they did was they broke down these experiences. There were 10 they identified, and they broke it down by category: abuse, neglect, and household dysfunction. And you can see underneath there, abuse was any kind of abuse. The only one they don't have in here is verbal abuse, like gaslighting, growing up with someone with substance abuse. And I know that was my story, and that was part of my story. That stuff, I consider that definitely, that gaslighting, just because it erodes on our self-trust. Neglect, emotional or physical neglect, household dysfunction. You can see there's alcoholism, drug use, loss of biological parent, depression or mental illness, mother treated violently, and someone in the household who was imprisoned. For us nurses, I've read studies that 40 to 70% of us are codependent, which means in a nutshell that we've developed unhealthy coping mechanisms that served us well in childhood, but in adulthood, sometimes not so great. That usually comes from assuming the role of caretaker as a child. So, in the household dysfunction under that category, growing up with a parent who had substance abuse or even who was chronically ill, mentally or physically, if you were put in that role of kind of like you took care of things, that's where codependency can stem from. These are the my interpretation, and this is my interpretation from personal experience and professional experience for 30 years of taking care of women with a history of trauma. It's not necessarily the experience, it's that feeling of not being safe, emotionally or physically, real or perceived. So, what that means is, and let's just take something very simple. If you were bullied at school and it really impacted you, that so much so that every day you go to school and you're thinking, what's going to happen today? Who's going to, like, are they going to tease me? And it's just constantly playing in your mind. That in itself can trigger fight, flight, or freeze. And in about 15 minutes, we'll get to how what causes the damage with ACEs is not the experience. It's the experience that causes fight, flight, or fight, flight, or freeze. And then what happens in the brain and the body because of that fight, flight, or freeze response. So, let's see. The original ACEs study, and that's the one I use only because that's the one the evidence is based on. Right? If you look, there is a group called acesconnection.com, and that is for healthcare professionals. So anyone can join it, but you can find the most up-to-date research. It's this is a new area, and so professionals, we're all just trying to figure out how to help people with this, and that is where trauma-informed care came from. But the original ACEs study, we just reviewed the different experiences. The expanded ACEs study took out single-headed household, and they added witnessing violence, not just to your mom, just witnessing violence, living in unsafe neighborhoods, experiencing racism, living in foster care, and experiencing bullying. Now, if you have a story, like we all have a story, but again, if your experience isn't on here, it does not mean that you didn't experience trauma. It's whatever left you feeling unsafe on a chronic basis. My interpretation of what the underlying factor here is with the ACEs. So generational adversity and trauma is huge. I call it the cycle of the story. And it happened in my family. I mean, the addiction in my family, 3 generations. It's crazy. And so the causes that are hurt adults, if they haven't healed the hurt, they often raise hurt children. Our childhood story is often all we know. So if you're growing up, what you see in your household, a lot of times when you experience adversity and trauma, you don't have a lot of friends outside the house because you don't want to bring people home. And so what you see is what you know. So you think that's normal. It's our comfort zone. It may stink, it may be horrible, but it's our comfort zone. And our brains are programmed to look for what we know unless we become self-aware and consciously change that up. So that's why you'll hear a lot of people end up marrying people like their parents, and then even if they get divorced, it's kind of like they always have the same person they're attracted to, just with a different name. And that's why they're not even conscious it's happening. Okay. I mean, the thing that's crazy is most all families have some degree of dysfunction. The problem is sometimes the family doesn't even realize they have dysfunction. So if you have, and you can keep track of this in your head, it's only 10 questions. They're yes or no, and I'll give you a few minutes. Don't take these questions super literally, right? Like if you read a question, go, yeah, that was kind of me, answer it yes, okay? I'll read them aloud and just count your yes answers, all right? Did you often or very often feel you didn't have enough to eat, you had to wear dirty clothes, had no one to protect you, or that your parents were too drunk or high to take care of you? Or that or you or take you to the doctor if needed it. These questions are very wordy. These are the actual CDC questions. So, second question, was your mother or stepmother often or very often pushed, grabbed, slapped, had something thrown or kicked, or she was kicked, bitten, hit with a fist or something hard, or repeatedly hit over at least a few minutes, or threatened with a gun or knife? Again, just keep track of your yes answers. Third one, did you live with anyone who was a problem drinker, alcoholic, or used street drugs? Fourth one, was a household member depressed or mentally ill? Again, I would count chronic physical illness in this for your own sake. Or did a household member attempt suicide? Number 5, did a household member go to prison while you were under the age of 18? Number 6, did a parent or other adult in the household frequently swear at you, insult you, put you down, or humiliate you? Or did they act in a way that made you feel afraid that you might be physically harmed? Now, I said they don't list verbal abuse in the actual classification, although this question is verbal abuse. Number 7, did a parent or other adult in the household frequently push, grab, slap, or throw something at you? Or did they ever hit you so hard that it left marks or that you were injured? Did an adult or person at least 5 years older than you ever touch, fondle, or have you touched or fondled them in a sexual way? Or attempt or actually have oral, anal, or vaginal intercourse with you? Number 9, did you often or very often feel that no one in your family loved you or thought you were important or special? Or your family didn't look out for each other, feel close to one another, or support one another? And the last question, were your parents ever separated or divorced? This is a question that in the new ones taken out. I wanted to mention earlier that what we're talking about today, if it triggers something in you, um, do the breathing we did in the beginning, and then my email address will be here. Reach out to me and we can talk about it. And I can, if you want referrals or resources, I'll be able to get that for you. Okay. All right. The prevalence of ACEs. There is, when you look up the study, these numbers that are listed here, you'll see different numbers in different places. The actual CDC site differs from the original CDC study. So take this one a little bit loosely. The scoring you just did. So if you scored 0 to 3, that doesn't carry with it any significant consequences. It does mean that you probably have some emotional baggage to work through, but nothing that would have affected your brain or body. Score 4 through 4, 5, and 6, that's where you start getting into some significant consequences. Anything above 6 is where you can see all of what we'll discuss, okay? 2 out of 3 participants in this study had at least one ACE. So that means like when you're out in the world, look to your left and your right. And if you don't have an ACE, that means somebody does. The relevance of that is how we get angered at people and we go, oh my God, I can't believe somebody did that. The whole idea in my mind of this study is to get people to look at one another and go, I wonder what happened, instead of just judging people for their reactions, right? Here's something really important. When any one ACE is present, there's an 87% chance of having another one and a 50% chance of 3 or more. The more ACEs you have, the more significant the consequences. And women are more likely to have a score greater than 5. And I believe that's due to sexual abuse. Um, Here's really a startling look at the last one, and this is on mine. Scores of greater or equal as 6. They have shown that life expectancy is reduced by 20 years. So when you take a look at zip codes with the poorest demographics, you know, I would love to see the ACEs scores because my guess is all hypertension, diabetes, early death. I believe it all ties in to the ACEs scoring. So that's where the significance of this is. It gives us a reason to say, why are groups of people so much sicker than the other? And you can take a look at the ACEs, which, by the way, we are not doing yet. I think California is the only state that routinely ask these questions to patients. And the reason we don't do it is because there is no definitive treatment. So, you know, it's kind of hard if you document something's wrong, you like to document that you intervened in some way. So, consequences of ACEs. Now, according to the ACEs study, the consequences only occur up to the age of 18. And the reason for that, I believe, was brain maturity. But now with them saying brain maturity is like 23, 24, you know, there's a little bit of leeway with that. I'm not sure how hard they're sticking to that 18. But behavioral consequences, cognitive issues, dental health, mental health, physical health, and social risk factors. I also throw in here emotional health too. In my experience, and again, this is my experience, I see a difference between emotional health and mental health. And once again, as the number of ACEs increase, the risk for following health problems increases in a strong graded fashion. I'm not going to read this whole list, but you can take a look at some of the health problems associated with ACEs. Some of the common ones: alcoholism, alcohol abuse. It affects cardiovascular system, the respiratory system, your metabolic. Diabetes is huge in this. Health-related quality of life. Autoimmune disease, you know, I kind of learned when you see somebody with 2 or 3, you go, think, start probing and gently, you know, and seeing how much of a background they did, because autoimmune is usually a really good indicator that somebody has experienced trauma in the past. Obesity, this list is, you know, it's kind of earth shaking. So cancer also, and stroke. Now, specific, these numbers are for school. Too much belly, 2 times as likely. Heart disease, 2 times as likely. Cancer, 2 times as likely. Pulmonary disease, 4 times as likely than someone with a score of 0 or 1, 2, or 3. Sex before the age of 15 is 6 times. Alcohol abuse, 7 times as likely. Just a side note on the alcohol abuse, we'll see that, we'll talk in a minute how these ACEs can often prevent proper development of the cognitive brain. One of the triads for alcohol abuse is an immature cognitive brain. When you put the pieces together, you know, it's kind of, it's mind-boggling. It really is. IV drug abuse or drug use, 10 times is likely, and suicide attempt is 12 times as likely. So when people have a score greater than 4, we really need to give them support and communicate with them in a way in which they feel comfortable with us to discuss some of these things with us, what's going on in their life outside of their physical health. One of the things I've seen too is that emotional health drives behavior, and behavior drives outcomes. So at least I worked with low-income moms, at-risk pregnancies in some of the poorer sections of Philadelphia, and I saw a lot that we were missing that very foundation of that emotional piece. And the way I learned to communicate with trauma patients, in that way, I addressed their humanness, not brokenness first. And it made a huge difference in outcomes. Um, in the big yellow is just that life expectancy, because it doesn't say you may have, there was a definitive 20 years cut. All right, Sandra Bloom. Sandra Bloom was involved, she's from Philadelphia, and she was involved in the original ACEs study. And her quote here is that average childhood experiences are the most basic and long-lasting cause of health risk behaviors, mental illness, social malfunction, disease, disability, death, and healthcare costs. If you tie ACEs into the current events of the past few weeks, you look at when people get really angry, and whether there's just cause or not, we'll see in a minute that the emotional center in ACEs gets overdeveloped. And so I wonder how much ACEs plays into just social issues and the problems we face as a race, human race. So that's where kind of my work long term is based in. All right. So to review, we're going to go over fight, flight, or freeze and the different stages. Just a review. I know we all know this stuff. So the underlying cause, chronic toxic stress. Chronic toxic stress, I compare it, or I differentiate it between acute stress and chronic toxic stress. They both trigger fight, flight, or freeze. The difference lies in that in acute stress, let's say the example they use is being chased by a tiger, right? So you think you're being chased by a tiger and your body ramps up and your sympathetic nervous system kicks in, you're rearing for a fight, okay? Once the tiger goes away, the body is able to rest and relax and to go back into a resting state. Where acute stress turns chronic is, if you look in the red, and it's written in the red there, is the point where once the tiger's gone, the body never goes back, rarely goes back to the resting state. Because in the child's mind, that tiger's always there. And so that's where my interpretation, I take it beyond the experience into it's whatever makes you feel unsafe, physically or emotionally, real or perceived. There could be no danger to a child, but if they feel they're in danger every single day, then it's going to be triggering fight, flight, or freeze. So you see the enormity, the gravity, and the difficulty of dealing with this is because we're dealing with people's perceptions of whether they're safe or not. So some of the organic issues, brain changes with chronic toxic stress. I'm going to show you something. I don't know if you can see it because I can't see myself. But for the purposes here, I'm going to use my fist as the primitive brain, the bottom one, and then the top one's the cognitive. Okay, like here's your primitive, here's your executive functions. So what happens is that when we have this chronic stress and this chronic feeling of not being safe, it releases the primary damaging one here is cortisol. Okay, but when that cortisol is released, it takes this brain, the primitive brain, which houses fight, flight, or freeze, and something called the amygdala, which is our emotional center. It's like a muscle. The more it gets worked, the bigger it gets, right? So it's chronically being triggered. So this primitive brain, the amygdala, gets enlarged. And there's a little thing we'll talk in a minute called the hippocampus that shrinks. But for right now, here's your primitive brain, enlarged amygdala. And what that results in is a lot of behavioral issues, reacting versus responding. So you'll see patients or children like their quick outburst, or they withdraw a lot. easily overwhelmed, difficulty controlling emotions, trouble forming relationships, and an atypical fear response, right? They're kind of like hypervigilant. And just to tell you, you may, if you've had trauma, you may recognize some of these. I recognize pretty much all of them, except for outburst and withdrawal, right? And so this, if you don't know that you've had this problem, you will be an adult and still experiencing all this. It can be reversed. The older you are when you notice it, the longer it takes. But everything that I'm going to tell you in the brain changes today can be reversed. Okay. So primitive brain, enlarged amygdala. Now let's go to, sorry, fingers are cold. Okay. I had mentioned in the primitive brain, the hippocampus. And the hippocampus is responsible for attention, learning, and memories. And I'm gonna lower my hand sec here. I describe the hippocampus is, I picture it like this filing cabinet, and it has all your memories and everything, and it's stored in chronological order. And so as it shrinks, it kind of like all the papers come flying out of the filing accordion folder, right? And so now everything's all over, and you've got past memories in the present, and I believe this is what causes when we get triggered. Okay. All right. So, you know what? Before I didn't remember this little amygdala here. The slides are not in the greatest order to do what I was going to do for that. All right. Parasympathetic, and I'm not going to review all these because I'm sure we all know them, but the parasympathetic is the green. It's I'm safe. So when it's acute chronic toxic stress and you're being chased by that tiger, once the tiger goes away, you're like, that's parasympathetic. Okay. And the message is go have fun, you're cool, no dangers ahead. Some of the physiological responses, all our hormones, body go back to normal. It decreases blood volume to the pertinent parts of the body, like the muscles, for example, when we're in danger. Everything returns back to normal here. So we take a look at sympathetic. This is when your body recognizes, I might be in danger. Am I safe? You know, how close is that tiger? This is our stress response. And the message it sends us is proceed with caution, prepare for danger. So this is when the body's preparing. I'm not going to go into this that much, but two things that I don't remember being taught in school was it can affect vision and hearing. Okay. Tunnel vision now I know, but then I didn't. All right. Freeze. If you remember, a while back, it was only fight or flight. Freeze was added when a Dr. Stephen Porges uncovered polyvagal theory. And so polyvagal theory is when your body freezes. It goes, okay, I'm in danger and I don't know what to do, right? The message here is I'm not safe. And a lot of times in freeze, and this can be momentary or it can last a while, your body is shutting down. And it all has to do with the vagal nerve. You'll see there's a ventral vagal, and I'm not going to go deeply into this, ventral vagal complex. That helps us with our connection and our social engagement with others. The dorsal vagal is, it shuts down when this happens. So here's some physiological responses, and I've actually experienced some of them. I never knew why it was happening until I saw this polyvagal theory. Auditory. So check this out. This is very cool. I had noticed when in times when I didn't feel safe, not physically, emotionally, right? There were certain people I was at, and I'd be places at restaurants. I'm like, wow, it's weird. I couldn't hear. It was like everything was muffled, but I had a hard time hearing just conversation and picking out the words. When I found polyvagal theory, I realized what was happening. So I didn't feel safe emotionally. And when you don't feel safe, you lose that mid-range hearing, which is voices. So think of it, when you're in danger, back to the like prehistoric days, right? When all like the body systems were designed to protect us, you need to hear low end and high end. And so that's what happens in polyvagal. Polyvagal is almost like your system goes back to this primitive state, right? Where you are seriously just in survival. Um, Facial muscles weaken. So you have reduced facial expressions, can't smile, like your eyes kind of glazed over. Vision's affected, tunnel vision, blurry vision. In this same period when I was saying I experienced polyvagal, I kept going to the eye doctors because I was having trouble seeing and my eyes were fine, but there was an inflammatory process in my eyes, right? So the stress was showing up in vision. It's crazy stuff. Social connection is improbable. So when somebody's in freeze, right? And I imagine this actually when someone gets a cancer diagnosis, right? Like we talk to them, but they're not taking anything in. That's because momentarily they are in freeze. And in freeze, because of the ventral vagal complex, you're not able to interpret the cues others are sending you. And likewise, you're not able to do what you normally do on a social basis, right? Like you're not as kind or caring. In freeze, you'll get like irritated and you just decision making goes because what's happening is in freeze is your brain or your sorry the heart is increasing blood flow to those organs that are needed when you're in danger. Muscles. Here's a really cool tidbit. I got to check on time. This topic's so huge, but here's something really interesting that I know as a nurse, I faced myself and a lot of nurses I know had issues with GI issues, irritable bowel, Crohn's. So what happens is when you're in freeze and nothing below the diaphragm, the major organs, gets perfused because the blood is going to what you need to fight the fight. And so think of it, if you have a higher ACEs score and you are chronic in this feeling, that means your GI is not getting perfused, which totally makes sense to all the GI issues we have. Same thing with migraines, headaches. In fight, flight, or freeze, our cognitive area, our brains aren't getting perfused because you don't need to think. You need the primitive brain when you're in danger. You need the emotional center to go, whoa, go, panic. Like you need to react, not respond. There's this slide. So where do we go from here? And if, let me say too, because there's so much more of this, I could talk for hours on this. If anyone wants more information, please reach out to me. I'd be happy to hop on a phone call with you and we can like talk about it because not only is it good for ourselves to know for our own stories because it impacts our self-care, thereby burnout, chronic toxic stress, but it's really important when dealing with your patients because you kind of have to, I found to be effective, you sort of have to switch up everything they taught you in nursing school if you went to nursing school back when I went to nursing school in the 80s. Okay. Key trauma informed principles. Excuse me. You'll find many different forms of trauma informed care. That acesconnection.com, which I mentioned earlier, the problem is right now is nothing is regulated because there are no 100% like this is the process when someone has ACEs score. You know, it's kind of trial and error for everyone. So you will see different principles. These principles were taken from SAMHSA. And I, when I'm doing my trainings for trauma informed care, I do trauma self-awareness care, but I kind of stick with the big agencies because you figure they're the ones that have done the most research, if any, on this. Some of the key really important ones that I've used myself in communicating with people who have trauma. Safety. You have to create a safe space. Like, and safe not only be physically, but safe from judgment. Because think about it, when you're a child and you're growing up, and you have ACEs and these issues, your self-confidence, your self-esteem, your self-worth is not optimal. And so you will feel judged with the smallest amount of things. So you have to create a space where they know that whatever they tell you, you're not going to judge. Trustworthiness and transparency. This is, I think, really hard for healthcare workers. And this is where I kind of found it came really easy. I don't have time to go into the story of why, but just suffice it to say, when I was 16, I needed to feel connected. I went out in the world and opened my heart to strangers and just talked to strangers, asked them questions, hugged strangers. And so I got very comfortable with being transparent and vulnerable. And I think that was one of the key factors that allowed my patients to do better. It was because I went into their visits as a woman, not a nurse. And that was key because it just created this safe, non-judgmental environment. Collaboration, mutuality is another one. Empowerment. This is also huge. Think of it when you're a child and you're growing up in a bad environment, you feel like you don't have any control. You feel like you don't have any choices. You feel powerless. So with people, I do this with everyone I try, but with particular people who have a background of adversity, you have to give them choices. Um, so let them feel that they're in control, that they are running the show. Instead of some I've seen traditionally, like I've seen with my clientele, the physician patient relationship almost becomes like a parent child. You know, like they're scolded by the doctor for doing things. And oftentimes it's their perception that they're being scolded, but that's really important because their perception is everything. Voice and choice goes right along with it. Peer support, mutual self-help. So peer support, I think another area in when I learned to communicate and work with people with trauma, I think this was very important, something I did by accident. I didn't mean to do it, but I would I would always relate what I was trying to teach them to either my experience or somebody else's experience. Because what that did, perfect example, I'd see women all the time grabbing their little kids, pulling them up. And I don't want to say, oh my God, don't do that. You're going to pull their arm out of the socket. But yet there's a fine line of teaching and where they feel, you don't want them to feel judged. So by relating it to something I experienced or something a friend of mine experienced, I'm putting us on the same level, which allows them not to feel judged. So you can teach them and not let them feel judged. Resilience, strength, and strength-based, inclusiveness and shared purpose. Oops, sorry. The other two were cultural sensitivity. Here's the deal. And again, this is just my experience working 30 years with women who have been traumatized. The best way to help them is to come at them as a person. So to acknowledge and validate their humanness before we jump into their brokenness, you know, and almost when I went to nursing school, there were these boundaries you didn't cross on what was a therapeutic relationship and non-therapeutic. With people who are really hurt from the past, you kind of have to break. I found you have to break that because otherwise, what happens is if we do the traditional forms of therapeutic communication, we healthcare workers often come off to the client who's been traumatized as judgy. We're judging them. We're not like, and for me, the difference, Brene Brown once said it, empathy, you walk down the street, guys in a hole, and empathy is like, hey man, I don't know if I can help you, but hop in the hole and I'll hang out with you here until you're okay. Whereas sympathies, you walk past the hole and you're like, oh, poor thing, can I get you anything? Right? So that's the difference. Now, where I think is, as if the statistics I quoted earlier about codependency are correct with nurses, mental health providers, social workers, sometimes our own stories, if we're not acknowledging our own past, can get in the way of helping people. Because if I don't acknowledge my own trauma, how well am I going to be able to help somebody else with their trauma if it reminds me of mine, right? I'm going to kind of put the wall up and pretend I know nothing of what they're talking about, when in reality, we got to walk in their shoes with them. um, Cycle your story. This is just, I've seen it over and over again in my own story and my patients. You know, you just look generation from generation. So breaking the cycle, one of the major problems is, and this is Einstein's quote, is that the mind that creates a problem cannot solve it. That's huge. I've also experienced this one too, with some cognitive issues and ADD. You know, if you have a dysregulated brain, and you live alone, you're using the dysregulated brain to train the dysregulated brain. Like it doesn't work so well. Healing for adverse childhood experiences. In my own experiences, this is what you need for healing. I call it the ABCs of ACEs. It's acceptance, belonging, compassion, support, and then awareness, curiosity, empathy, and safety. Um, those are the characteristics that you really, if you can manage those, you'll really be able to help people. The solution, awareness, self-awareness. The only way to break the cycle is self-awareness. And here's where part of the problem comes, as far as you look at this as a societal problem, is as providers and educators, we can show them the tools and support them. But at the end of the day, it's like going to the gym. If you want to get like really toned, you can't hire someone to lift the weights and then you'll be toned. You know what I mean? So the ultimate work here lies with the person who's been traumatized, and a lot of times they don't have support networks, and it's really hard to do that when you don't have a healthy support network. All right, so here's where I want to bring this into us in our own care. So if you have an ACEs score greater than 4, and you've got a few autoimmune disorders, your relationships aren't that great, you may be a little bit overweight, you may suffer anxiety, depression, there's a really good chance that what you're experiencing is tying back to your childhood, okay? And that in combination with when we wear the mask, when we put the armor on, we're not able to connect with our bodies. And I think in the midst of work, we totally ignore our bodies. But in order to self-regulate, you have to be able to notice when you're going into fight, flight, or freeze. So that's where it's really important. Self-care starts with the story, but take that and the demands of nursing, um, the two together just set us up for being really unhealthy. I didn't include the slide in here, but the ANA, I mean, it's ridiculous statistics. Not a rather healthy bunch, and myself included. I mean, I'm right there. I'm never going to accuse anyone of anything if I'm not perfect. So self-regulation. Self-regulation is simply just being able to go, okay, I feel like I'm getting triggered. Um, Let me take a look what's going on in my body. That breath we did in the beginning, that's really important. And when I started doing this work, mindfulness and meditation and all the mind-body work that I'm trained in, I noticed I was holding my breath so much of the day. It was ridiculous. So I set my phone alarm to every half hour, every hour to go off. And it would just remind me to take 6 breaths and just to check in and breathe and go, okay, what am I feeling? Okay, that's cool. So it just got me in the habit of sensing what was going on in my body. So the goals of self-regulation, self-awareness, self-connection, self-inquiry, self-regulation, mindfulness. What I've learned in my work is that at the end of the day, that feeling of not being safe when we're kids, it causes us to hide who we are. And then when we're nurses, a lot of us put the mask, the armor on because we think we won't get hurt. And here's what I found. If you don't feel safe to just totally be you, then a lot of issues with self-trust, self-doubt, they all creep up and just perpetuate this. So the really important thing is to be authentic, um, connect mind and body, and be able to trust yourself so that you feel safe in your own skin. We're really short on time. This stuff I'm not going to read for you. Authenticity is huge. Different treatment modalities. There are just a bunch of different therapies that you can do. Newer ones, complementary alternative, acupuncture, I've heard it works very well. Animal assisted works really well. Reason being, animals create a safe space. Of course, equine therapy really has shown to be effective with trauma. And again, they're non-threatening. They will love you no matter what. They're not going to judge you. And safe is the key word in trauma. Art therapy, tapping, herbal medicine. These things are awesome. I've used a lot of them. Brain spotting, I have not. EMDR, I have. And we're just about to run out of time. But this one's really valuable. When I was younger, I had a lazy eye, and I had to do these exercises. So you'll see me like windshield wiper with my finger in front of my eyes, and you follow left, follow right, follow up, follow down. Next time you're anxious, even though you don't have a lazy eye, try that out, because that's a very rudimentary form of EMDR, and you're breaking the pattern between the left and right brain. That's the purpose of EMDR, and to connect it with, it's more than that, but give it a shot. It helps me. I told you, here's the primitive brain, right? My apologies. Primitive brain's really enlarged. Here's your cognitive brain. So as this being's worked a lot, the cognitive brain does not develop the way it should. So a lot of people who have trauma, ADD is huge. Any type of, what they call it, neurodiverse nowadays. ADD is huge. Poor executive function skills. We tend to be more creative in trauma. And after interviewing nurses, like I've found a lot of us fit that picture. So yoga is really good. Yoga has been found because it ties your mind and body together. You're connecting the two through yoga. Integrative somatic work, I tried that, hit or miss. Okay, cool. Should I keep going, or is your clock like mine, Natalie? Okay, I'll keep talking until she tells me to stop. Okay.
Oh, hi.
Hey.
Hi, Leslie. This is Ashley.
Oh, yes. Hi.
It's about 10 till. We do have a couple questions. So if you want to, just go a little bit further and we can chat a little bit. Okay.
Yeah. So to wrap it up, and again, I'm sorry, this is just, again, it's a huge topic. But if you have your own traumas, right? Practice being a little more open and vulnerable with yourself first, and then sharing with your patients, because I gotta be honest, I think that's actually how I healed without really trying, is that I just through teaching, I a little bit talked about things all the time. But breathing is your number one go-to whenever you're feeling stressed, whenever you're feeling triggered. According to research, 6 breaths, diaphragmatic breathing, will reset the stress cycle. Okay, and the importance on diaphragmatic breathing is and the exhale is more important than the inhale, because when you breathe out, your belly's going in, which puts pressure on the back of your body, around the spine area, and that activates the vagus nerve, which activates parasympathetic. The second thing is, for breathing, whatever it is to help you feel safe. For the longest time, I would just say, well, I am safe. I am safe. I got your back. I am safe. Because all this, in my opinion, is professional and personal. experience and opinion, this all goes down to safety. It's about not feeling free, not feeling free to just be you. So if you're hiding from other people, eventually you hide from yourself. And if you hide from yourself, you can't heal under a mask or armor. I think I'll end it at that, actually. Ashley?
Yep, I'm here. I'm here. Can you hear me okay?
I can hear you. I'm ready for if.
Sure. We had a couple people asking if you could give the resource website that you had mentioned earlier, and I can type it into the chat for everybody.
Oh, sure. ACES, AC, it's www. ACES, ACES, connection, CONNECTION.com. There's a lot of stuff on there. It can be a little hard to maneuver. I also, if you want to put my email, info@aconversationwithheart.com. Reach out to me because ACEs and chronic toxic stress is my area of expertise. I actually turned a couple of docs on to this chronic toxic stress. I saw it show up in millennials, and I've seen their diabetes increase, which CDC confirmed the numbers. So I think this is chronic toxic stress, I think, is a much bigger problem than childhood. I think we're going to see it now with this too. But ACEs connection, it can be a little overwhelming, the amount of information.
We also were asked, can you explain more about the atypical fear response?
Yeah, sure. The atypical fear response is, so there's something in the body called neuroception, right? We all know about perception, where our brain, the cognitive brain's like, it's telling us real quick, the amygdala, the emotional center, that lets us know when we're physically in danger or not, right? And that has to do with the emotional piece. But then when a trigger comes in, it goes either to the amygdala, then up to the cognitive brain, or it goes up to the cognitive brain down. And the importance of that is the brain will either associate a smell, a taste, a noise with something that left you feeling unsafe before. So that patient or yourself, you're going to find you jump really, like you jump at things you shouldn't jump at. You know what I mean? And that you're fearful of things when there's nothing to be fearful of. And it's because of this neuroception, which is part of the autonomic nervous system. You can't control it. But it's the body senses, has nothing to do with cognitive brain. It's sensing that you're in danger based on the external stimuli. And so the only way to deal with that neuroception, since you can't stop it, is to notice what's happening in your body, breathe, and then kick in parasympathetic shots to minimize the chronic toxic stress. Did that make sense? I know it was loud. I was trying to shorten it there.
That sounded great. We were also asked, can chronic toxic stress have effects on pregnancy and be transferred through the placenta to the baby?
Well, check this out. So there's a lot of work now on epigenetics, right? And so what it says is that if a mom, and I always wondered this, I think I actually my experience is if a mom has trauma, now trauma can be like you can have somebody die or you're just under verbal abuse all the time, right? So I actually don't like the word trauma. If a mom feels chronically unsafe while she is pregnant, she can change the fetus's DNA, not the outer covering, the superficial, like the actual DNA at any point during the gestation. The impact of that, think of that. You know how we always go based on physical, on an H&P? Well, if you have a child now whose DNA has been changed, that H&P is of family history is useless because the child has its own mix that's different. It's a whole different breed. I mean, the impact of this is crazy, but yes, it's not, it does. It can change fetal DNA and affect the fetus. So that's why it's really important when women are pregnant to teach them how, and it's a very big huge problem. But at the foundation of it, it's very simple. It's learning to connect mind and body and notice when you're going into this crime, when you're anxious, and breathe. And it minimizes the damage of chronic toxic stress.
Thank you. Okay, one more. What is EFT, tapping?
Oh, tapping. Okay, so tapping too. It's a way, tell me if you can see. So when you tap, if you need confidence, if you're anxious, the way it goes, and here's a really mini, you take your wrist, right? And you tap 25 times on your wrist. And as you're doing it, you're going, whatever you want, like I love and accept you as you are, whatever to build yourself up. Then you tap on your forehead a couple times and you're repeating what it is. So let's say I had a migraine. I go, okay, I know you have a migraine. I know you have a migraine. And then you go to the side of your eye and you keep saying, but like, I prefer not to have a migraine. Then you go under your eye and then you go above your lip and then your chin. And you'll find tons of stuff on YouTube on these. And then your collarbones, under your arm, and then your head. And you repeat this as many times as you needed. When I do it with clients, I tell them to, at the very beginning, give me a score, 0 to 10. How's your anxiety? And then after like after 2 rounds, usually I say, how's your score now? And we keep doing it. And it's amazing the way it works. It's all based on energy. Same kind of ideas that you're hitting these meridian points. And so it's distributing the energy. If you have a patient who's really anxious, get them up, breathe, but then get them to move their body because it moves the energy in the body. Same idea as Reiki and stuff like that. All the things that help ACEs are really the old Eastern ways of medicine and healing. A lot of Western medicine, it's okay, but the Eastern stuff's really what helps you heal from within.
Oh, thank you. Thank you very much for everything today. Yeah, we appreciate having you here.
You're welcome. And again, feel free to about this stuff because it's so fascinating. For our own health and well-being, our kids and clients. I mean, it's just societal.
Thank you, Leslie.
Great day, everyone, and stay safe out there.
Thank you. You too.
Okay, bye-bye. And it's good.